Today I'd like to talk about two complications that can arise from injecting with neurotoxin, so anti-wrinkle injections. The first one is a brow ptosis. So this is when the brow area drops. So it drops, causing a hooded area on the eye and almost like a lion look. This happens when a practitioner injects either too much neurotoxin in the frontalis muscle, causing it to drop, or they inject the frontalis muscle too low down in the forehead, subsequently causing a drop in the area. It can also happen if a practitioner is trying to hit the corrugator muscles responsible for a brow lift and they hit too high. Everybody's anatomy is different. So if they miss the corrugator and subsequently hit the frontalis, this again in turn causes a brow drop. If this happens in practice, there are things that we can do. I always think prevention is better than cure, hence why I'm always really conservative, especially with my first treatment of anti-wrinkle on the frontalis. But we can inject around the orbital rim underneath the brow to slightly lift. But as I say, I always prefer to, prevention rather than cure. The second one is what happens when we hit the levator muscle, which causes something called an eyelid ptosis. So this is where the eyelid drops. This is one of the most serious complications with anti-wrinkle injections because there isn't anything we can do to correct this. It does, however, wear off in a couple of weeks. It doesn't take the whole longevity of your treatment to wear off, but it's something that we need to ensure that we don't happen. By doing this, what the practitioner usually does when this happens is they're trying to inject the orbital rim and they miss and they hit the muscle that's responsible, the levator muscle, for lifting the eyelid. So what it does is it lifts the eyelid, so we inject it and it drops it. So that's why it's very careful to understand everybody's anatomy is all different, to inject really superficially in this area to avoid hitting the muscle. Anyway, take care. Have a lovely day.